So thank you very much for that introduction. It helps me explain because I'm from the University of Liverpool, but we're funded by LifeArc and we're part of a huge ecosystem, but I've got my own ecosystem, so it's a whole thing. But I am specifically rare kidney disease, but pediatric focused. So our whole project is pediatric focused. So I'll get that out there before we carry on. I think if we go next. Okay, we're on to the first slide. Okay, so what I'm going to run through is a brief introduction to patient and public engagement and involvement. I like to get that out there because if it's a whole presentation about it, I need to get everyone on the same page. Then I'm going to talk a little bit more about the paediatric rare disease landscape, which I know we've heard from a little bit today, so I'll just give some more detail. Then talking about how we created a foundation for our PPIE project, our methodology specifically, the diversity and inclusion within PPIE, and then our model that we've sort of built from that. The activities that we've currently done, and then sort of our future goals within the ecosystem. So we'll start with a definition, very exciting. So the definition of public involvement and engagement, I'll just be calling it PPIE from now on, is research being carried out with or by members of the public and or patients rather than to, about or for them. So then we can go even more specifically in what's the difference between involvement and engagement. And so involvement is more sort of the first process where we're actively collaborating with people affected by various conditions, whatever your project is, so that they can shape the research decisions, ideas, and landscape. And then engagement, more to do with communicating the research, the sort of after bit, how do we make sure that this is all digestible for everyone that will be absorbing, and communicating plans and progress and that type of thing. So the pediatric rare disease landscape, 75% of all rare diseases will affect children, with 70% of the world's rare diseases first presenting themselves within childhood, which is just a vast population. And we've had parents, mothers talk about this today, with more than 30% of children with rare diseases will die before their 5th birthday. And yet they remain not the main focus of rare disease research. So in order to treat and transform the rare disease landscape, children need to be included in research. We, of course, know there are limitations to including children within research, but some of the proposed limitations are a bit silly, like children can't take tablets, but that's all they're doing all day, every day. So we need to get over these hurdles, and that PPIE allows children to be involved throughout the process, not just the clinical trial, but the before, the during, the after, and to ensure this happens safely. So when we talk about creating a foundation for PPIE, we should first start with establish what's already occurring within your field. Now, each of it will be differently. As we've said, we're all in different specific rare diseases. Everything, all the work that will be going on will be different within each field. But you need to work out what are your patient support groups, what are the previous activities that have already existed, what's worked, what hasn't worked, and what is the published work that's occurred. This allows you to establish what are the current gaps in research, the current gaps in patient support, within knowledge, and what already exists. It's important to harness the power of groups. We've heard from a couple of patient groups already. These are, often unfunded. These are powerful mothers, fathers, families who have come together, spending hours of their time to create these groups, and they're doing amazing work, and you can only learn from them. And it's essential to build relationships within these groups for PPIE. Then to establish your research question. And I would also say that you need to be prepared for your research question to change once you present this to families and to people who with lived experience, because they know the actual truth and what the questions that need to be answered. So from what you might have already, the idea that you already have will be changed. But this is the most important part of the planning process so you can move forward. So what we've done specifically, obviously, I've said that we're pediatric and then obviously rare kidney disease. So ours looks a little bit different to what everyone else's might. But we first conducted a literature review, so just a scoping review to find out all the literature that's being published sort of around clinical trials, specifically kidney clinical trials and patient groups. Then we met with collaborators. As we've already said, our project is externally funded, so we had a few people to meet with to see what other groups are doing, to make sure there's no overlap, so that we can all divide and conquer rather than reinventing the wheel. And it also highlights areas for partnerships. And then finally, which was the most important part for us, which was meeting with charities and patient groups. So these are a couple of the logos of the groups we met with and we worked closely with. And these gave the real insight into how was a patient group going to run what would this look like, even down to the logistics, and then down to, it's too much to ask people to meet every month when they've already got all of their other patient groups that they're attending. Be more realistic. And that was honestly the best part. So So now on to diversity inclusion. Now, from our scope and activities, we established that, which has been mentioned, that sometimes you end up recruiting the same type of person, and this can be limited by the condition that you are associated with. So some conditions are specifically associated with one ethnicity, but that's not the case for a huge portion of rare diseases and rare kidney diseases specifically. So it's not an excuse not to recruit outside of this. So to ensure that your project is accessible, you need to increase inclusion from the planning stages that can be implemented across. And then I have a quote at the bottom, which I stole from KR UK's Draft and Discovery Week, which is, if we're not actively including, we are excluding. So that's what you need to go forward with all your work. If you're not working to include groups, then you are excluding groups. So when we reflected on previous work with our scope and review, we obviously highlighted loads of different papers, but these were the three that really stuck out to me that we used then to make our model of inclusion. So we have the first paper, which was utilising a social prescribing charity within Liverpool and connecting them up with patients in Alderhay, specifically. This was kidney patients, and it was Louise, who's running our project. She had tried to do all of these different types of PPI activities, and it was just creating further burden on patients and parents. It wasn't, providing any insight or help to them. So we connected them up with the charity, and they were able to connect them up with different social groups and different government sort of policies and stuff, which allows them to have further support, financial support, and then we could also at the same time find out about what was the quality of care that they were getting, because this was a huge population of people that were just not being heard. Next, we have highlighting the importance of accessible patient information and participation. So we've heard about information being digestible and not just being all clinical gobbledygook. So this was another paper that highlighted that. And then finally, understanding the digital living standards within households for children. So this is another paper that's been published within the University of Liverpool. And this was actually shocked with how many people live below the digital living standard. And it means that when you're considering patient groups or models for inclusion, even though that sounds like something we all have, and it's, can we access these people when they come into clinic and not ask for anything extra, just intervene where you can, where they're waiting for their infusion to start and that type of stuff. So this is our model for inclusion. I've never seen it so big. So this is what we're running alongside our traditional patient group. So we have different levels of involvement to ensure that it's more accessible, and we're working alongside the same social prescribing group that Louise worked with in the initial thing. And we have then direct contact with patients that we know are kidney specific and also have been in contact with that support group, and we can sort of connect the dots. We also have opportunities with different youth clubs that are not specific to kidney, but they can get involved with that as well. And then we also have the options for one-to-one meetings with the facilitator, which is me. And I'm quite lucky that this is my full-time position, because I can spend my time and offer my services at random hours of the day. I don't mind to meet with parents and patients. So our current PPI activities, we've done some external work to do with EMPA Kidney, which is a new drug that's trialing. We've done a specific IgA vasculitis event. We did a diet post-transplant event. We have drawn attention to children with rare kidney disease in different not rare disease focused areas, and we've brought patients and parents along to them things. We've created our model for engagement, and we're also in the developmental stage for our PPI working group. And then most excitingly, we have a children's book, which is everyone's favorite bit. So we've worked closely with a specialist author, and he's already wrote a book called Ready for Research. And so it's a similar vibe to that, where that book was to help children sort of get involved with research, and so is this, but we've just made it a bit more kidney specific. However, I think once it's out, it could be for any rare disease. It's more about being unseen and how often these conditions can be invisible, and it's to help being seen and just doing the normal kid stuff. And so that is hopefully going to be published in time for World Book Day. It's currently with Kidney Research UK with their children's board, and they are reviewing it and making sure that they like all the wording and the pictures and that type of stuff. So we're quite far into that. So now onto the Kidney Collective, which is the name I've coined for our Children's Advisory Board. So this is for children and young people aged 8 to 18 years old with lived experience of rare kidney disease, consulting on all stages of research. So this is our main PPIE project within the kidney ecosystem, which has got all sorts of its own things going on. And we are currently in the ethics stage of this now. Now, when I started, ethics wasn't needed, and then now you start, ethics is needed, and that's a whole shebang in itself. But the purpose of this group is to act as a contact for external researchers who are conducting research within the rare kidney disease space so that they have an easy and accessible point of contact. I understand that researchers haven't got time, haven't got funding, have to do this all by themselves. So we're trying to act as an accessible point and also to lessen the burden on the patients as they just have me to contact rather than all these other people that they get involved with. And it also means that I'm able to implement my own sort of code of conduct with the researchers as well. So they always have to feed back to the patients. The patients always get paid for all of their involvement, even if that's just a 5-minute call. It doesn't matter. It's all supported. And because we're linked with the university and then the hospital, we have all the services that we can refer to as well. Oh, back. Okay, our future plans within the ecosystem are just to progress on with the Kidney Collective, hopefully early next year with ethical approval. You'll see some lovely posters going around, which are a bit more exciting than this presentation because I don't have to do all official with that. We will be assessing the framework, which will run alongside. So as soon as the Kidney Collective launches, the framework launches at the same time, and we'll be assessing them together, and then we'll be publishing work about that. And then we have some key deliverables as part of the ecosystem, such as getting the kids group to inform on grant applications and patient information sheets, and then to continue the support PPI activities, which are my favourite part, just doing the random events, meeting with patients, meeting with parents is the best part of the job, and then finally publish the book. And then, oh, thank you for listening. There we go.